Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Congestive heart failure. So here in congestive heart failure, it is the pulmonary capillary wedge pressure. So there is a pulmonary capillary wedge pressure. So it is also known as a PSWP, and this will be more than that of 13 to 18 mmHg. So what is normal? The normal will be 12 mmHg. Then the back pressure. The back pressure, it will increase and goes into the pulmonary veins. This leads to the pulmonary venous hypertension. Here the pulmonary venous hypertension, that will lead to the cephalization of the blood flow. So cephalization of the blood flow, and it gives a stag antler horn sign. So it gives a stag antler horn sign, and there is a hands up sign as well as the inverted mustache sign. There is presence of the inverted mustache sign, and when the PCWP, it is 18 to 24. So PCWP is 18 to 25. It pumps the fluid into the interstitium. Pumps fluid. This is into the interstitium, and it causes the interstitial edema. Next, when you look at the chest X-ray, there is it is presented as a curly B sign, and it lies at the base, and the curly A lines the hilum. So the curly B sign is at the base, B for the base, A lines the hilum. Next, moving on to the stage 3, the stage 3 will be greater. So this is greater than 25 mmHg, and the fluid gets filled into the alveoli. The fluid is filled in the alveoli, and it leads to the alveolar edema. Now, what is the bat wing appearance? So bat wing appearance, opacity, is predominant in the perihellar region, and it becomes prominent perihellar regions, and it is bilaterally very symmetrical. So bilaterally it is symmetrical. To learn and grow daily like this, please do subscribe.